Welcome everyone to the 8th session of the WHO Costing, Budgeting, Financing, and Delivery of COVID-19 Vaccines Learning Series. Today's session will focus on the Pfizer COVID-19 vaccine planning and implementation. My name is Bruce Strumminger and I'm with Project ECHO, and we're very pleased to be supporting this series. And I'm going to quickly run through some logistics and housekeeping. Next slide. We have interpretation in French and Spanish available, so please take advantage of that for our Francophone and Spanish-speaking colleagues by clicking on the interpretation button at the bottom right of the Zoom toolbar, little globe. And if just select the language you'd like to be listening to. If you only want to hear the interpretation and not the original language, click mute original audio. Next slide. We really want this to be as interactive as possible and look forward to your questions and comments. Please put those in the Q&A feature just to the left of the interpretation icon. And we'll be monitoring the Q&A and hope to get to as many of those questions and comments as we're able to. Any that we're not able to address during the session, we will try to address afterwards and be sharing a transcript of the questions and responses. If you have any IT or logistic questions or questions about the certificate of attendance, please put those in the chat and we'll try to address them as best we can. Next slide. We are offering simultaneous closed caption transcription for English. So for anyone who'd like to be able to read the English as subtitles, go ahead and click on the closed caption icon, live transcript icon. Next slide. We are recording today's session, as we've been recording all the sessions in the series, and your attendance is consent to be recorded. Thank you for that. The recordings will be shared afterward, both on the TechNet 21 website, and we'll share a link to that, as well as on a Project ECHO site supporting the series. And those recordings will be available for the English, French, and Spanish. We are offering a certificate of attendance through the University of New Mexico, where Project ECHO is based. We'll share a link in the chat about 15 minutes before the end of the session, and you'll have 48 hours to complete a feedback survey that should take 3 or 4 minutes. We really appreciate your feedback and hope you will give us that feedback about how the session went, future improvements for future sessions you'd like to see, and please take advantage of that opportunity. Next slide. Just a quick note about data use. We take data stewardship very seriously, and all the data you share when you register in the Q&A, through the chat, etc., is kept very carefully, and what is shared with WHO is all de-identified. Next slide. With that, it's my pleasure to hand the microphone over to Imran Mirza with UNICEF to moderate the session. Imran.
Thank you, Bruce. Good morning, good afternoon, good evening, colleagues and friends. I'm Imran Mirza from UNICEF New York. Let me start So I'll start with the announcement, some of the announcements. Next slide, please. Yes, there are some important reads. We have developed different guidelines which are available in the various languages. There's a guidance document on the development of the National Deployment Vaccination Plans. There are the job aids, how to manage stored COVID vaccines. There's also guidance on conducting vaccine effectiveness evaluations, updating trainings on handling, surveillance, and the competency framework. Next slide, please. The forthcoming sessions, today's one is on the Pfizer, 22nd of September. The next session next week will be learnings from the Eastern Mediterranean and Western Pacific countries. And then there are sessions till 8th of December where you can find, and if you're interested, please register yourself in those sessions. Next slide, please. So agenda for today's session, we'll be covering 3 topics. One is the COVID vaccines rollout delivery strategies, different options, cold chain and logistics, especially for the Pfizer vaccine, and demand and risk communication related implications on the Pfizer and the multiple vaccines rollout in the countries. So these will be the 3 agenda items for today's session. Next slide, please. Goal and learning objectives of today's one is to help support health workers in the Pfizer vaccines rollout by sharing strategies that could effectively reach high-risk populations with important vaccines. And by the end of the sessions, you'll be briefed on the various delivery strategies to scale up COVID vaccines, including Pfizer, as well as how to manage storage and handling of the Pfizer vaccine, especially under ultra cold temperatures conditions, including ancillary products. Next slide, please. Before going to that one, we like to have a introductory poll. And there will be 3 questions which we like you is, are you currently implementing multiple delivery strategies, including mass vaccination centers to reach people with COVID-19 vaccine in your country? Is yes, no, or maybe. Have you used guidance documents on acceptance and demand for COVID-19 vaccines? And have you used the training modules on handling, storing, and transporting Pfizer COVID-19 vaccine? Yeah, here are the 3 poll questions. So we'd like you to answer those ones, and then we'll proceed to the first topic. Thank you. Okay, so we'll start with the first topic. These are the results. So good, about 67% have said that they are using multiple delivery strategies in the countries, including mass vaccination. 24% no, and 9% they said maybe. Have you used a guidance document on acceptance and demand for the COVID-19 vaccine? 56% has said yes, they are using those documents. 29% has said no, and 16% has said maybe. Have you used the training modules on handling, storing, and transporting Pfizer vaccines? 49% has said yes, 38% said no, and 13% maybe. So we will be covering these 3 topics, and then we will do a post session, another poll, and see how much you have been able to learn from this session. Thank you. So we'll start with the first session on the COVID-19 vaccines rollout delivery strategies. Next slide, please. Next slide, please. Objectives of this session that you all know that in coming months, countries will start receiving huge quantities of COVID-19 vaccines, including the Pfizer vaccines with a limited shelf life. There will be need for increasing the access to the vaccine services to reach those populations. And to achieve this, countries will be required to choose appropriate delivery strategies to enhance vaccine utilization. And to do that one, ensure high uptake in specific populations, particularly in the high-risk groups, and to have equitable access to all the populations based on your national deployment vaccine plans to achieve. Currently, in most of the countries, coverage is quite low, not only to the Pfizer vaccines, but all other COVID-19 vaccine products. And most of the countries has to increase their utilization by multiple times, from 2 times to up to 8 times in many countries. So that can only be possible unless we increase the delivery strategies. Next slide, please. For that one, we need to have a key principles to keep in mind. We all know that one size does not fit all. So every country has to design, adopt different delivery strategies based on their population demographics, prioritization, needs, operational resources, COVID-19 positivity rates, vaccine availability, and different things. Each country may need to have a multiple delivery strategies. Even at the subnational level, it may not be a one strategy. You may need to adopt multiple delivery strategies in a small geographical area also, depending is urban area, it is a rural area, and what. So program managers will be need to devise non-traditional and novel immunization strategies to reach those priority populations. For this one, you need to be focused, and focus should be on how you're going to maximize utilization of the vaccine, minimize wastage, and systematically track, monitor to reach those populations which are difficult to reach. Every strategy has a different enablers, and all enablers has to be considered before deciding on that strategy. For this one, you will need extra support in all the countries and consider strategic public-private partnerships, which can expedite implementation planning and offer innovative solutions for communications, delivery, and tracking. Next slide, please. So some of the key delivery strategies, what we are showing today, as they are under the fixed ones as well as the temporary sites. Fixed one, most of the countries are already using the current health facilities or the hospitals from where the countries are providing. We are also suggest some countries has already started using the mass vaccine immunization centers or mass vaccination centers or the drive-through sites. On the temporary sites, we can have a mobile health units, which can be moving as the outreaches, normally what we do in the routine immunization program, and the community-based pop-ups, which goes to the communities for some time period, and then they move from community to community. Next slide, please. As I mentioned that all these ones have enablers. I'm not going to do details of all the enablers, but all the different strategies will need the human resources. Additional staff will be required, trained staff will be required, there will be online training will be required, forecasting for the resources will be required, appointments needs to be required to minimize the wastage, that the people who will be coming, that if they can be registered and how they can be registered in advance, or if they are not registered, countries should consider the walk-in waitlist policy to minimize wastage. Because it happens in many countries that people register themselves, but they don't turn up. So avoid the wastage, then government should have the policy for the walk-in vaccination. Planning and logistics. For every strategies, you need to see what will be required, needs are, and how it can be done. Contingency plannings, demands, monitoring. Communication strategies depending on your different strategies. So it again, communication strategy cannot be a one strategy for everything. People should know what are the different strategies and how you are going to communicate to the people, to your communities. And also on the strategic partnerships, that you will need private facilities providers, CSOs, registrations for them to help. Third-party logistics, if you need mass vaccination centers or the drive-through sites, you will need the venues, you need the logistics. So you may need private partnerships or from the corporate sectors, your partnerships. Next slide, please. For considerations for coordinated planning for each delivery strategy, first thing you will need are planning considerations, that you need the updated micro plans with the budget cost, what is required, what resources will be required for the human resources, financial, operational needs, distribution nationals, where is your national cold storage, how you're going to distribute your vaccines. Details will be covered in the next session. Transportation, in-country logistics, social mobilizations, and sites can utilize available doses. And for most of the countries has already established, have the NITACs, which are the regulatory mechanisms for the coordination, ICCs or the Emergency Operation Centers, EOCs, resources, program implementation for the mass vaccination sites, logistics, communications, and the partnership. So this will be required. Coordination will be a big coordination, not at the national, subnational level, but especially for the mass vaccination centers or the drive-through centers, you will need coordination at that level also. Next slide, please. So first is the fixed sites. Example is the health centers or hospitals, which is already probably in place in all the countries. And main objective of this is to leverage trusted patients to provide relationships with the different networks, and people know that they can come to the health centers and they can get the vaccines. I'm not going to the details, but just the trade-offs on the benefits challenges, that it's leverage on the existing infrastructure. You don't need to have established a new infrastructures. You already have the trained workforce, experienced people in those health centers. People already know the health workers in that one. The challenges will be in some health centers, the spaces are small spaces for the physical distancing and need to manage day-to-day operations and workload from the campaigns and complex supply chain with more endpoints. So that's a challenge which you have to consider on those ones. Next slide, please. Max vaccination centers, some countries are already doing that one. It's also a fixed site, and the mass vaccination center is to immunize a high volume of individuals through the large sites. Like you can establish their centers in the sports venues, football grounds, any parking lots or the hotel conference centers where you can get about 1,000 to 2,000 people every day, the multiple points in the same place where people can come and get the vaccines. Some countries has converted the vaccination screening centers into the now vaccination immunization centers. So the benefits of this one is that this can be established in the urban areas where you have a big populations, and you can start vaccinating more than 1,000 people to up to the 2,000 or 3,000 people, depending on the resources in a single day. So you can vaccinate a lot of people in those centers, fixed centers approach. Benefits will be the simple distribution, as shipments will go to the few number of sites. Like in urban center, you have 2 or 3 this center, then you will be only distributing vaccines to only 2 or 3 sites instead of 20 or 30 multiple sites in the urban areas. Low risk of the no-shows and waste due to the long queues of people that can backfill spots, because there were a lot of people will coming. So if someone will not come, you can still have a people to be vaccinated. So you can minimize your vaccine wastage. There's a challenges in that one. To establish those centers, it takes time and it needs a full operational capacity. You need a lot of resources. Logistics for physical access to the sites, traffic management, parkings, security needs, large quantities of supplies to meet demand, transmission risk if not well managed given large number of people. So you need to make sure that you have a physical distancing and all the IPC measures in place in those places. And it is in flexibility of scaling up or scaling down such a site quickly, because it takes a lot of time to establish those sites. So it will take time to establishing, and then you cannot just close down a same day. So you have to reduce that one. Next slide, please. Drive-through vaccine centers is another strategy which some countries are doing. I showed the picture in advance, and Namibia has doing, and some other countries are doing. Here, the people who can drive, who have a car, they can go, instead of entering any building, they can keep sitting in their car and they can get the vaccine and leave. So this is efficiently, conveniently immunized high volume individuals also with a minimal exposure to the virus in the large open lots. As we mentioned, can be established in the parks, stadium parking lots, shopping mall parking lots, on open spaces. And some people, they prefer that they don't want to enter to the health facility where there are other people, so they can keep sitting in the car and they can get the vaccine. Benefits of this one is a low disease transmission risk, because recipient community people, they will not be mixing with other people, they will be in their cars. High volume throughout, as there's a minimal disinfection requirement. Ability to vaccinate individuals with mobility issues and in self-isolation. And central hub limits deliveries to other sites. But they still also have a challenges for this one. If there's a weather is not good, it can cause delays, because then it will be a problem for vaccinators to be standing outside in the open place, or the people to come in a car if there's a heavy rains or there's a weather one. Requires significant logistical preparations and planning on the design and flow of operations. Can result in traffic congestions, risk of traffic collisions, slowing down processes, and accessory issues for those without cars. So these are the challenges. Next slide, please. This is the design, a kind of design from Namibia. And you can say that for the drive-through, you need a big space, and you have to have a proper planned thing where the cars will come, how they will be parked in lanes, and people does not have to come out of their car. So it should be a drive-through mechanism. In many countries, you have seen like McDonald's, some places where they have a drive-through places. You can go and you can get your services. So it's also on the same lines that you keep sitting the car. You need a lane where you can go and you get the vaccine and you will leave. So this is just a design, and you can see that it has to be well planned thing. Otherwise, it will have a problems. Next slide, please. Temporary mobile health units. This is normally we use in the normal measles campaigns, polio campaigns, or other vaccine preventive disease campaigns, mobile, which goes from the village to village or far off areas. Standard. This is the same approach, which could enable reach vaccination rural and remote areas, and those with the greater needs of care, or where you cannot establish fixed sites. So it's a mobile units group. It also has benefits and challenges. Benefits is that it reaches to the people who have a mobility challenges, special needs, or underserved areas. Geographical coverage for remote areas which may have limited existence healthcare infrastructures, and where other delivery strategies are not possible. There are many countries where there's problems that you cannot go on daily basis. So you plan well, and with coordination of the local communities and everyone, that mobile will come on those days specifically, and they will get the vaccine. The challenges, again, same as the weather, because you will need a vehicle, you need to travel, and if there's a bad weather or is a mountainous area and those geographical trains where is a problem, it may affect. Individuals not ready for mobile health units upon arrival, maybe a potential language problems, cultural barriers, and those ones. Because the mobile will be there for the limited time on a limited day, and if the people are not available at that time, it may be a problem, and it will be lead to the vaccine wastage. And this is we also see in our regular routine immunization programs also. So it has to be well planned in coordination with the local communities and the local leaders and those ones. It's not suitable for the high volume velocity needs, because mobile unit cannot carry so many doses, and we don't have so many staff in the mobile unit. So it cannot, it will have a challenge if there's a high volume of that one. Access to systems for the data entry, because it's not a fixed site. And if the countries are doing online data entry on the computers, and on that one, it may not be possible on the mobile. So it has to be done on the paper, and then on the daily basis, it has to be entered in the national database system. So that's also one big challenge. Next slide, please. Community pop-ups are also for the small areas in urbans, and could facilitate vaccinations in communities in rural areas at small event places like faith-based sites, churches, mosques, community centers, schools, to increase vaccination for the underserved or vaccine hesitant populations. It can be even for the slums, city slums, and those areas where you can establish like normal measles and the polio campaigns to establish few days, site at one place, and you vaccinate all those areas, then you establish another area and do the vaccination there. It has benefits that it accesses the segments with moderate mobility challenges and additional special needs, where the people cannot go far to get the vaccine, can increase the vaccine rates in vaccine hesitant segments of the population, geographic coverage for remote areas where other administration models are not acceptable. It also has a challenges, risk of no-shows, and product vaccine waste. This is same like we see in our routine immunization outreaches or the normal campaigns. If people are team went to the any community area to establish a site and people doesn't come up, means that you will waste your vaccine there. Adverse weathers can cause delays. Access to systems for the dental entry, same like our mobile units, and may not be within the vaccine transport guidelines. So these are the challenges. Next slide, please. So for all these strategies, you will need all of the human resources, because current to increase, that for the routine immunization program, our target is normally under 1. For the measles, polio campaigns up to 5 years. Here in COVID, you need to vaccinate all the population, all adult populations. So you need recruitment and the traditional recruitment and additional people. You will need a new additional people, trained people, and you need to utilize experienced staff from other departments who can share. So getting the more human resources, countries need to see from where they can get additional trained vaccinators who can give the vaccine. Trainings, different strategies, different products, including the Pfizer. You need to train all of those vaccinators and the people involved in this one. Plus, one-time training will not be enough. You need to retrain them every week, because the things may change, the issues can come up, the staff turnover can be there. So it cannot be a one-time training. You need to plan for the retraining on every week or every second week. Scheduling registration, need to develop the plans, how to register people and vaccine administration to plan those ones. You need to develop workforce models for range of scenarios, including increased vaccine supply, adverse events, and those ones. You need operational procedures, including policies and key processes, reporting, measuring, gathering, decision-making guides, emergency preparedness, how to handle the AFIs. You need to expand eligibility criteria for clinical workforce. Like in some countries, because of the shortage of the trained vaccinators, they are using the dentists who can also provide injections. Medical nursing students, retired professionals, and different people who can be seen. Even you can check with the as a part of the private partnerships, consider partnership with the non-profits, regional volunteer groups, who can also support you on on-site management and administration, because health workers cannot do everything on the site. You will need extra people who can do management administration, especially for the mass vaccination centers. Next slide, please. So if you see a scenario of example of the mass vaccine center, we just is that this is just an example, scenario example, that it is for 16 vaccinations per station per hour per shift. So if we say that patients per hour by the type of the staff, validate to patient information, but the patient comes, it will take 3 minutes. Time to vaccinate is around 6 minutes. Time to sanitize the station, depending how extensive you want, around 3 minutes. Time to change gloves, how often? 1 minute. And the clinical things. Number of flows lines depend also what are the maximum number of stations, that also ensures proper distancing. Like if it's a big hall, big place, you can establish about 8 or 10 stations where you can give the vaccines. So then you have to see how much space and how much distance you need between the different stations for the people to come. Will there be a special line for individuals with mobility issues, seniors, people who are coming on the wheelchairs? You will need a special space for them so they can come on their wheelchair, or the people who are old, senior citizens, they need have access to that one. And what will be the mix between the experienced and inexperienced period? Here we mean that what are the trained vaccinators and the staff which needs only admin work. Utilization, does the supply limitations limit with the daily volume, time it takes to new staff to get up to the speed, because people, there will be turnover of the staff. Can scheduling reduce unproductive staff time between the patient? So for example, if we say that in a site we have 16 stations and one vaccinator for each two stations, the vaccinator job is just to give vaccine, not to do any admin work. And if we have a two shifts, like from 8 in the morning till 2 p.m. and 2 p.m. to 8 p.m. So you will need about 16 vaccinators. Approximately about 1,000, 2,000 people can be vaccinated. And this is only when vaccinator is only giving the vaccine, while all the admin and the paperwork is done by the support staff. So this is based. So that is how, when you are planning a mass vaccination center, you have to plan how many vaccinators you will need, how many extra admin and support staff you will need, and what work is required. Next slide, please. For all those ones, you will need to have a supply forecast, vaccines as well as the ancillary supplies, devices, planning, logistic executions. Because once you establish, and we have seen in many countries that they are saying that they created a demand in the communities, people were coming to the sites and there was no vaccine. So for all those delivery strategies, you need a very good supply forecast and logistics system that there is no shortage of vaccine in those sites. And the delivery strategies and forecasting base should be based on your site, the number of people you are planning to vaccinate in each site, and how you are going to do that, so you can cover that one. For that one, you need a procurement that you should know how much vaccine you have in place and how you are going to do that one. If the vaccines quantities at the country level are small, you don't you you plan accordingly that how many sites you can cover for long term, because you cannot establish a site for 3 days and then there's no vaccine and then you said you are closing down. So you need to do a very well planned planning for those things. Warehousing, where you are going to store the vaccines, the storage for cold chain, not only the cold chain, but also the ancillary supplies, the devices, syringes, and those things. If you need any third-party partnerships for the logistics, you need to do that one agreements in place in advance. Distribution, logistics, as we mentioned, administration, how you are going to alignment of the stocks with client volume, tracking actual throughout, and wastage, those things. So you need to do from the procurement till the administration, you need a very well planned, and you need to monitor and trace for this end-to-end visibility. Next slide, please. For, as I said, that you will need a lot of additional resources, additional people, human resources, and the venues and for admin staff and those. So countries may need partnerships, can boost infrastructure and vaccine deliveries, because health sections, EPI people, they cannot cover everything, so they will need the partnerships. You will need the partnership for the infrastructures, for the venues, where you can do that one. You can do the partnership for the resources with the local government, private corporations, CSOs. You can do the partnerships for the technology. If on the data entry and the registration, you want to do partnerships with any mobile companies or anyone, or data analysis, analytics, you can do that one also. You can do the partnerships from the service delivery partnerships, like for the workforce, non-traditional partnership with the clinical, non-clinical work, volunteers, like for example, Red Crescent, the country, multiple private clinics, private hospitals. Private partnerships can enhance non-core operational capabilities, where they can help in the logistics, leveraging private sector partners like the Crown Agents, UPS, Korea's Coca-Cola, DHL, people who can help countries for the logistics support. Access, you can also have a people who are going to the centers, you can have a partnership, provide with any local taxi companies or the religious community centers who can provide access to the elderly people or the people who can come to the centers and provide the transport to them. Use mobile vaccination centers to reach communities without access. If you need more transport, you can do the partnerships to get those vehicles, and establish also mechanism to ensure continuous communication. So you can do a lot of partnership with the different areas and different sectors. Next slide, please. Just a small one on the vaccination microplanning. Next slide, please. So this is a general, again, a small for the different, because you know the Pfizer specific for the Pfizer vaccine, which is specific, and it will be coming in the trays and the doses, and you need to order an operating assumption. This is just slide. I'm not going to delays. I'll just give you one example how you have to plan well for those sites. For example, if you are doing in the hospital, and normally Pfizer vaccine will come in a tray. The countries who have received, they know that it comes in the trays, and in each tray there are about 195 vials, and each vial has 6 doses. This means that one tray will have about 1,170 doses. So hospitals, if you order, like for example, 5 trays, which means that 5,850, you need a storage capacity that you can keep them for 7 days at 2 to 8 degrees fridge. You do need the use ultra cold chain in every place, and we will cover in the next session. So, and if you are planning that you will be vaccinating around 1,000 people per day, so this will be covered in 6 to 7 days. What you will need then 14 vaccinators, depending how many you need, depending how much workload you want, and planning that if you're doing 6 patients per hour, 6 minutes per patient, 8 hours shifts, 2 shifts per day, and you will be doing vaccines about 672 vaccines per day. So it means that you will be replacing, or you will be need a 1 tray every week. You don't need to send them tray every second day or every third day. You plan that how often you have to supply the tray to that hospital. So this is the examples, calculations for every different site, that how often you have to provide the logistics and how much you have to send them the new vaccines batches, that one. So you make sure that vaccines is not lying in the site, is not used or get wasted or expired. So this is just an example for each site, how often you need to plan and how well you plan the different strategies. Next slide, please. Next slide. We have developed a different additional resources for these ones. One of the guidance on the WHO code vaccines before the date expiry is already developed by the WHO. The WHO guidance on the microplanning is coming soon, is almost ready in the draft form. So it will be released soon. And other training materials is available, the courses. They are the courses on the cold chain, which will be covered in the next sessions. And there's a lot of material resources on the social mobilization on those ones, which also be covered in the next sessions. I think this was the last slide. Next slide, please. Yeah, I'd like to thank on this one that our WHO partners, the CDC Atlanta, Gavi, the Vaccine Alliance, the GSI, MMGS, and Gates Foundation in helping us to develop this the slides. Thank you. Next slide, please. Yeah, so now we have a point for the question and answers. So we have now 10 minutes for the question answer. If there are any question answers, I'm happy to respond. Okay, I can see 3 questions are in the Q&A. One is, I will need someone to help me. There's one in French, I could not. So let me start with the English one first. One is, what is the minimum shelf life of vaccine required for countries for smooth uptake of vaccines, as we are getting from that huge amount of vaccines will be, shelf lives are different for the different products. For the Pfizer vaccine, the shelf life will be now recently WHO, it will be covered in the next session, but Pfizer has been giving the shelf life of -90 degrees for up to the 9 months. So Pfizer will have a long shelf life at the ULT level in the minus 90 degrees. And for the other products, normally it's 4 to 6 months. But as you know, there's a shortage of vaccines. So some of the donors who are coming with a small shelf life, but still those shelf lives are at least are 2 to 3 months shelf lives. So if the countries has planned well, everything with those quantities, they can still use within that limited shelf lives. And that's why we are suggesting to minimize those wastage and expiry. Countries need to plan well to establish multiple delivery strategies so they can reach more people in the shortest period of time. One question is which kind of training that is to be conducted every week? Is this formal training or update? Yes, the first will be the initial training, but I think on the retrainings on the weekly every week is just the updates. If there's any change in the shelf life or with the rollout of your vaccine, you see any problems, any challenges, any lessons learned, and you want to tell other health workers that if this thing happens, you have to do like that. So it's an on-job training that we do normally in the routine programs also. So it's not a formal trainings, but the on-the-job updates for the if there's any changes. Which strategy is preferable for Pfizer vaccine rollout in low CC infrastructure setup? For the Pfizer vaccines, we are providing ultra cold chains, and I think it will be covered in the next sessions. On the strategies, country had to see about the human resources, infrastructure, those things. So it's not, as I mentioned, it's not a one strategy. So it may be even in a one district, you may need a different strategies. In urban area, you may have a different strategy. In the rural area, in the different. Even in the urban areas, depending on the resources and the locations, you may need a different strategy. So this is we are giving different options. We are not saying that only this strategy is good and this is not good. Every country has to see what are their requirements, what are the populations and resources they have, and how which strategy will be more useful, which can reach maximum people of the people in a limited time. Are you sharing the presentation? Yes, we will be sharing these presentations later on. What is the way forward on routinizing COVID vaccines with the RI? Good question. It is too early to say. It may come later on, but at the moment we need to stop the pandemic. And there is a discussion start going on that once the pandemic will be over, it may become as a part of the routine program, depending on the availability of the vaccines doses, vaccines in the future, and the country's policy in those ones. Okay, this is on India. This is a separate, we can discuss that one. What are the target populations eligible to get Pfizer vaccines in final approved to use? Can Pfizer would be used as a second dose or the third dose mixing with the first dose? At the moment, with the stage ones, it is coming that there are two products which can be given as a second dose, and we will follow with the WHO guidelines and the national ones. So WHO SAGE is still reviewing, and the EUL is coming. So it's all based on the what is the recent guidance from the WHO on that one. These are all the questions. Any other questions? And if there's any questions, please keep writing and we can respond to you later on. Next slide, please. So I think the session is, yeah. So I will hand over to the next session for the Quotient Logistics. Will be done by our colleagues from WHO, Maricel Castro and Anahita Sherzad from UNICEF. Over to Maricel and Anahita.
Thank you very much, Imran. So I will be discussing the first part of this presentation, and then I will turn over to Anahita for the second part. Next slide, please. For the overview, as you know, vaccination is one of the most effective interventions to prevent high mortality and morbidity from infection, from vaccine-preventable diseases, particularly with this COVID-19 pandemic. So among the COVID-19 vaccines approved under the Emergency Use Listing, or EUL, only the Pfizer vaccine requires storage at ultra low temperature. Only very few countries actually have experience managing vaccine in this storage condition. And this session aims to support health workers in ensuring that populations at risk are reached and administered with potent Pfizer biotech COVID-19 vaccine. Next slide, please. So for the session goal, we aim to ensure potent Pfizer vaccine is administered to the high-risk population. And we hope that by the end of this session, the audience will be able to know how to effectively manage the vaccine at different storage conditions and minimize vaccine wastage, and to guide their decision when they are considering to establish a functional ultra-cold chain system, including the selection of the appropriate storage and transport equipment to support the Pfizer vaccine rollout. Also, we have an additional topic on guiding the health workers on the selection of an alternative injection device when they are faced with supply shortage. Next slide, please. So currently, we have several resource materials that is specific to Pfizer vaccine. We have on the supply chain, we have this training on handling, storing, and transporting Pfizer vaccine. It has 8 modules covering different topics on vaccine management, cold chain, and supply chain management. And we also have the Pfizer-specific training that covers non-supply chain topics such as vaccine preparation and administration, including adverse events following immunization. So you can find the link to these resources in this slide, which will be shared with you. And we also, so all of these resources are part of the COVID-19 vaccine introduction toolkit at the WHO website. But in addition to that, we also created a technical resource library in TechNet 21, where you can access other resources that are developed by other organizations such as US CDC and Pfizer itself, in addition to what has been developed by UNICEF and WHO. So for this session, we will be focusing on the training on the handling, storing, and transporting Pfizer
Have we lost Anahita?
Okay, can you hear me?
Yes, Anahita.
Yes, so this is Maricel. So next slide, please. So now we are showing the summary of the recommended storage duration at different storage temperatures. So as you know, an open frozen vial of the vaccine should be stored in ultra cold temperature. So the range is -60 up to -90 degrees, but just to simplify, we are using -80. As mentioned by Imran, there is a new WHO communication saying that that approves the extension of the shelf life from 6 months to 9 months. But this will apply to future deliveries because it's possible that countries are still using the supply with the 6 months shelf life. So one important message here is whatever is the expiration date written on the vial, you have to respect that expiration date. So the frozen vial can also be stored at -20 degrees centigrade for up to 2 weeks for a single period within the vaccine's shelf life, which is now 9 months. And then the thawed vial should be stored at +2 to 8 degrees centigrade for 31 days or 1 month. The diluted vaccine should be stored at +2 to 8 degrees centigrade for 6 hours after dilution or at the end of the immunization session, whichever comes first. With regards to the diluent, it is recommended to store the diluent at room temperature, not exceeding 30 degrees centigrade, But during the session, we recommend to store it at the same temperature as the vaccine. So definitely, the diluent can be stored at room temperature until expiration date or until it's used. Next slide, please. So these are the key considerations on managing vaccine storage and shelf life. So we really encourage to consume the vaccine before they expire to minimize wastage. So vaccines are not meant to be stored longer. They are really, once you receive the supply, we really hope that the supply can be utilized as much as possible to be able to maximize the benefit of the vaccine. And again, vaccines can now be stored at ultra cold, low temperature for 9 months after the manufacturing date, and you can find the expiration date marked on the vaccine label. So if local distribution is needed and full cartons containing the vials cannot be transported at ultra low temperature, vials may be transported at -20 degrees. But you have to remember that any hours that you use for transporting the vaccine at this temperature is counted against the 2 weeks limit for keeping the Pfizer vaccine in that temperature condition. So once you put it in the -20 degrees temperature, you may return the vaccine to ultra low temperature only for once. And this, as much as possible, do this only if necessary. So we really encourage to, progress the use of the vaccine at +2 to 8, and not to keep on putting it back and forth between -20 and -80. So this is not, this is really not encouraged. But once a return of the vaccine from -20 to -80 is possible, but use this or do this under special circumstances. And some of the examples of these situations is when you are receiving international delivery of the vaccine to the central hub and the ULT freezer is still full, then you can temporarily store the vaccine at -20 for maximum of 2 weeks. And then once the ULT freezer has free space, then you can move the vaccine to ultra low temperature. And the same is true when you encounter the same condition of lack of space in the ULT freezer in the subnational UCC hub. So this is just a temporary solution and only to be used when necessary. So next slide, please. So now we are showing the key consideration on managing the vaccine storage and shelf life. So vaccine can also be transported at +2 to 8 before the end of the 2-week period at -20 degrees centigrade. In this case, the new expiration date at +2 to 8 should be updated on the label. So that is the 31-day shelf life at this temperature condition. Please do not refreeze stored vaccine. And limit the transportation at +2 to 8 to 12 hours to prevent transportation stress. This is because the NRA vaccine products are much more fragile and susceptible to damage from vibration and rigorous shaking. And this information is based on the physical studies that was done by the manufacturer. Apply dynamic labeling whenever you move the vaccine from one temperature condition to another. The dynamic labeling is discussed in the module 1 of the training on handling, transporting, and managing Pfizer vaccine, as mentioned, as shown in the earlier slide. Always check the updated expiration date against the original expiration date. If the end date of the vaccine shelf life at -20 and +2 to 8 degrees centigrade exceeds the expiration date originally marked on the vaccine label, please respect the original expiration date. And as much as possible, try to synchronize the vaccine delivery with the vaccination session plan to be able to utilize the vaccine as soon as possible. Next slide, please. So now we move to the different options for establishing ultra cold chain system when you are considering to receive the Pfizer vaccine. When you plan to set up the UCC system, please try to keep in mind the following principle. First is to minimize the ultra-cold chain infrastructure requirements while allowing broader access and uptake of the vaccine without significant UCC investment. So this means as much as possible limiting the installation of ULT freezer at the higher level vaccine store and maximizing the existing fridges and freezers at lower stores. So 31 days should be sufficient to be able to use the vaccine at positive 2 to 8 at the lower level facilities. And then choosing the suitable UCC equipment based on the local context and sustainability. So my colleague Anahita Shirazad will be discussing the different criteria for the selection of an appropriate UCC equipment for establishing UCC hubs. And then the second principle is reducing wastage risk given the novelty of the UCC product and stringent vaccine management requirements. So this means transporting the vaccine in appropriate temperature condition, immediately utilizing the vaccine within its remaining shelf life, and ensuring that the infrastructure is appropriate and ready for UCC equipment installation. Next slide, please. So this slide shows the 3 options that we are recommending when you are planning to establish a UCC system. These are categorized into 2, the cascading vaccine deployment strategy and the rapid vaccine deployment strategy. Under the cascading deployment strategy, there are 2 options that you may consider. One is the establishing a UCC system where there is a single centralized UCC hub. So this means that there is one UCC storage hub at the central store, and then the subnational storage hub will be maximizing the existing -20 and positive 2 to 8 freezers and fridges, possibly with the skipping of some store levels. And then at the service point or lower facility level, they could use the WHO pre-qualified insulated POSIT containers for storage at positive 2 to 8. So this scenario, the immunization is likely to be conducted both at the central hub and at the secondary locations. But whatever choice you select, it is important that careful monitoring is done to avoid undue vaccine wastage. So the second scenario under the cascading vaccine deployment strategy is the establishing multiple UCC hubs. Here you have one UCC storage hub at the central store, and then you also establish few strategically located UCC storage hub at the subnational level. And then likewise, in the lower level store, the existing positive 2 to 8 and the -20 degrees centigrade freezers and fridges will be used, and positive containers at the service points. So for the rapid deployment strategy, there is one single centralized UCC hub, which will be, sorry, I think the image is not the correct image, apologize for that, but this should be one central UCC hub at the central store, and then this central store will can store the vaccine either at ULT, -20 or positive 2 to 8. But of course, we want to maximize the shelf life at -80 degrees centigrade. So the vaccine may be thawed or moved to -20 when it's ready to deliver directly to the service points. So this is the design. So here you have one UCC storage at the central store, and then you will be using the positive 2 to 8 degrees centigrade storage equipment to deliver the vaccine at the service facilities. So now the advantage and disadvantages of these 2 approaches. First, we discussed the cascading vaccine deployment. So as for the advantage, it is cost effective as the UCC investment is limited to the central store and strategically located areas. And then it is maximizing the existing dual temperature storage capacity at the lower level stores. And then the presence of these freezers at the subnational and district stores would allow vaccine to be delivered frozen at -20, therefore eliminating the risk of transport stress if the vaccine is to be delivered at +2 to 8, especially in situation where the transport may last longer than 12 hours. For the disadvantage, the cascading deployment strategy is a bit slow with regards to distribution mechanism. Therefore, there is a risk of further reducing the shelf life if the vaccine stays longer at the subnational stores before reaching the service points. This would require full tracking of vaccine movement, the remaining shelf life, and the storage temperature at the service points, because it has gone through different layers of the supply chain. And this may yield a higher transport cost due to the several layers of deliveries, and may yield vaccine wastage due to risk of heat exposure during storage and transport. Next slide, please. So with regards to the rapid vaccine deployment strategy, the advantages is since you only have to establish UCC hub in the central store, so it's a bit cost saving with regards to UCC investment. And then there is less storage burden at the subnational and district level for UCC. It's rapid vaccine distribution mechanism, and which can lead to potentially high vaccine consumption and low wastage rate because the vaccine will be delivered by demand. This means session has to be planned around the expected date of delivery of the vaccine. The shelf life is maximized as the vaccine is stored in ULC freezer at the central hub and will only be thawed as needed. They may save on the transport cost due to the skipping of different or several store levels. And this also promotes strong coordination between the national staff and the service facility for planning vaccination session around the time of vaccine delivery. And this enables effective monitoring of vaccine deliveries and uptake and wastage because of the direct communication between the immunization providers and the supply chain officers. With regards to the disadvantages, the thawed vaccine will be at risk of transportation stress, especially if the travel time to deliver at the service point takes more than 12 hours. So therefore, it requires careful tracking of the vaccine movement, shelf life, and storage temperature until it reaches the service point. And this requires robust system for monitoring and recording the vaccine supply and movement. So the following, next slide, please. So the following are key considerations on managing the UCC hubs. Site readiness is very important before you install the UCC equipment, and maintenance capacity should be in place. So there should be an appropriate door size. The space should be big enough to accommodate the installation of the equipment as well as to facilitate the routine activities inside the hub. There should be a constant power supply, preferably from the main powers, and then there should be an auto start backup generator, and adequate air conditioning. So the details of this will be discussed further by Anahita in the second half of this presentation. There should be a robust inventory management and temperature tracking system. So we know that the current supply of COVID-19 vaccine do not have VVN, so we recommend health workers to follow the strategy for managing this vaccine without VVN. So the link to the guidance is on this slide. So there should be a strong management at the national and subnational hubs. So especially with regards to managing the vaccine at the central storage and the dispatch and management of the coolant packs. There should be adequate number of trained staff for each hub, and at minimum, at least one cold chain technician and 2 assistants that will be managing the coolant packs. Next slide, please. So can maybe move to next slide. Yes. So next is the provision of constant supply of personal protective equipment for the staff, because managing the vaccine under ultra low temperature condition poses some risk, especially when handling the coolant pack. So staff should be provided with safety goggles and insulated gloves for their protection. And most importantly, there should be available appropriate cold chain equipment for each layer of the supply chain. So there should be ULT freezer corresponding to the number of UCC hubs that you plan to establish and with sufficient capacity to store the required vaccine quantity. Maximize as much as possible the use of the existing vaccine freezers and refrigerators. And for transporting vaccine, you may consider having Arctech device with PCM designed for ultra low temperature use, or having some thermal shipping containers for dry ice use. And then the additional equipment based on the coolant pack that you plan to use for managing the Pfizer vaccine includes another smaller ULT freezer that you will be using for the preparation and storage of the ULT PCM if you are using Arctech for storage and transport at the lowest store levels or service points. Or you can consider investing on a dry ice machine or identifying a reliable source of dry ice if you're using this for storage and transport. And then, of course, the use of the, yes?
Maricel, please, translators are having a problem. Can you read slowly, please? Because they need to translate also. Thanks.
Okay, sorry. Yes, and of course, the use of the standard vaccine carriers or freeze preventive vaccine carriers with their appropriate coolant packs. So at this point, I will be giving the floor to my colleague, Anahita Sherzad, to discuss the different consideration and requirements for ULT freezers. Thank you.
Anahita, over to you.
Thank you.
Yeah, please move to the next slide.
Thank you. So building on the different strategies that Maricel has presented, we will now provide a brief overview of the key considerations to take into account when quantifying ultra-low temperature freezer needs, selecting different type of models and sizes, and ensuring the adequate functioning. So compared to the traditional cold chain equipment, the ultra-low temperature freezers are big size and bulky, and therefore it is essential that the building that will house the ULT equipment would have big enough entrance doors to bring in the equipment, that where it is going to be installed in the building, that it has that the ULT freezer will not be exposed to sunlight, and that the building has adequate air conditioning, or the building is big enough to install the required air conditioners. The ULT freezers are very sensitive to ambient temperature around the equipment, and to ensure that they can maintain the ultra-low temperature. And further, the ULT freezers, they do generate a lot of heat. And for this reason, it's critical that there is approximately 0.5 meter space, free space around the ULT freezer to enable the hot air to escape. As the ULT freezers, they do consume a lot of electricity compared to the traditional cold chain equipment. And as an example, as a ULT freezer of the size of 700 liters would consume approximately equivalent electricity equivalent to 20 cubic meter walk-in cool room. Therefore, also it is recommended to select equipment with the smallest footprint per liter storage space required. So to determine which size of equipment that will be required, a generic formula has been developed, including search capacity, where it is, I think it is listed in the guidance document, technical guidance document. Now the number of doses multiplied by 3 and divided by 1,000 would give the liter of storage space That is the generic formula. Having said that, in the technical guidance document, there is also a list of equipment where by manufacturer and model size, the exact number of doses that can be stored in the equipment are listed. So determining the volume required for the ULT freezers is to apply either generic formula, or if you are clear on which model to be used, what is listed specifically for that equipment, plus surge capacity. As for the initial or current allocations, they may not represent the peak volumes, and I think we are looking at Pfizer vaccines, the deliveries to increase as well as we move towards Q4 and Q1 next year. So it's always good to ensure some surge capacity is available. In terms of electricity supply, so this type of equipment has a short holdover time, actually to reach the minus 60 degrees, which is the maximum limit for ensuring the Pfizer vaccine is still at the frozen temperature. So continuous power supply from the mains is really critical, and ensuring backup generators with automatic startup and UPS. And we can just note that in general, chest freezers, they would have larger footprint than the upright freezers. So when we look into the power consumption, it is also recommended to select a model with the lowest power consumption to reduce the size of the required backup generator. And for temperature monitoring, it is not all ULT freezers that do come with a built-in RTMD. So it's also important to ensure when considering the different models, which ones are coming with installed temperature monitoring devices. Just to note also that there are 30-day temperature monitoring devices for ultra-low temperature freezers that are now available. But like the Fridge Tag Ultra-Low from Berlinger and the Trell 8 from Logtech, but they're not yet pre-qualified. Next slide, please. So another aspect to consider is the climate zone. So when selecting the ULT freezers, that they're tested for the different ambient temperatures that are applicable for your country's climate zone, and to ensure air conditioning is available when choosing units for higher climate zones. Having said this, we do recommend that air conditioning, as mentioned in the previous slide, is installed in all storage spaces or warehouses where the ULT freezers are going to be held. In terms of holdover time, as also mentioned, it is very short for the ultra-low temperature freezers. Therefore, it is important to note what is the holdover time when selecting the equipment. There is, in the same matrix, it's at the end of module 4 in the technical guidance, also listed by manufacturer and model, the holdover time for each equipment. And it does vary from 80 minutes to up to 14 hours. So there's quite a bit of difference. Yes, so in terms of the required maintenance, all ULTF freezers, they do require manual removal of ice and frost, especially around the doors and the seals. And it is generally recommended to defrost minimum once per year. But in terms of maintenance, it's also important for the ease of maintenance to consider standardization. So if a country already has ULT freezer models in place, to select similar equipment or brands. Alternatively, to select models that would require less maintenance, and there are some models that don't require maintenance. As ULT freezers, there are significant investment in many cases, and in view of a future changing thermostability profile, and also now with the extended shelf life, it is recommended to consider when looking at the different types of ULT freezer models, Also to look at equipment that can function at dual temperature, meaning at -80 and -20 degrees, to maximize the use of the equipment. It will be worth considering for sustainable investment in terms of also being able to use that later on in the routine immunization, for routine immunization activities. Next slide, please. So with the current thermostability profile of Pfizer vaccines, which is 2 weeks at -20 degrees and 31 days at 2 to 8 degrees beyond the ultra-low temperature storage, traditional existing cold chain equipment should be used for the lower level distribution, as Maricel has also indicated and explained, both in terms of active and passive devices. Here are just illustrated some examples. So if a country, and we would like to also note that, faces storage capacity issues with traditional existing cold chain equipment, it may be full with routine immunization vaccine or other campaign vaccines, it is important to consider looking to third parties, for example, leasing of additional storage capacity. Next slide, please. So with this slide, we want to primarily highlight the temperature monitoring for passive devices, especially the ones for ultra-low temperature, the thermal shipper container, as well as the Arctic. So the thermal shipper container does not have a temperature monitoring device, the standard one. And what we are looking at here is that it's using dry ice, and that will be the indication that the ultra-low temperature is maintained. As long as blocks of dry ice is visible, the ultra-low temperature should be maintained. And in general, the replenishment is considered to be every 5 days. However, in hot zone countries, it may be more frequently. It is important to ensure that there's regular dry ice replenishment and also backup suppliers for this. Related to the Arctic, this is a special model, ultra-low temperature model YVC5E. That one is using the ULT phase change material, PCM, and it is equipped with a temperature monitoring device that is called a hobologger. It's a metal coolant top that is being applied here. Just to note on the thermal shipper, that there is the standard thermal shipper that we're referring to up here that also has been used for the Ebola, but there's also the soft box, that's the one developed by Pfizer, that has built-in temperature monitoring device, that equipment that is to be returned within 30 days.
Anahita, can we please move fast because we have only 10 minutes and another demand session also.
Sure.
Thank you.
Next slide, please. So the key messages that we want to mention here related to establishing ultra-low temperature storage systems is to be careful in terms of looking at the longer term needs assessment when looking at the investments for future use also in routine immunization and taking into account the changing vaccine profile that we mentioned just earlier. New stability profiles are expected to be available early next year, and also just now the shelf life has been extended from 6 months to 9 months. It is not encouraged to deploy ultra-low temperature equipment at the lower levels, but to use existing cold chain equipment at the shelf life, cold chain equipment at 2 to 8 degrees, as well as the fact that the quantities that are required at lower levels with smaller facilities, the power supply may be more unreliable and therefore the ULT cannot be guaranteed. We are mentioning this because we do see a number of countries that are requesting or buying significant numbers of ultra-low temperature freezers for district level, and we do not recommend that. Our recommendation is for central level installation, and then for bigger countries, big populations, plus subnational level, to have ultra-low temperature freezers there as well. Next slide, please. So apart from the challenges and consideration to take into account related to building up the ultra-low temperature storage system, there are also some other challenges within the supply chain that we are currently facing, and unfortunately we do face a shortage of 0.3 ml syringe and needles. While the standard process is, after dilution, that the vaccine vial that contains 2.25 ml, 6 doses of 0.3 ml would be extracted using the 0.3 ml syringes. We are looking at the new recommendations or alternative recommendations from WHO on what to use instead. Just briefly mention why we are in this situation currently. And the reason is that we had a significant increase of the Pfizer vaccine donation, which was not bundled. That means the donation was the vaccine without the syringes. We went from 40 million doses to 500 million doses at short notice. Hence, the 0.3 LM syringes have not been forecasted. And then the manufacturer's production capacity related to unforecasted quantities, and the fact that this is the non-standard size 80 syringe. So we do have a plea that when discussing with donors to ensure that there is a bundled donation, vaccines and syringes. So in terms of the recommendation from WHO, I think we can go to the next slide, is if a pre-qualified 0.3 ml 80 syringe is not available, to use a pre-qualified 1 ml or 2 ml reuse preventive syringe that would meet the following requirements that are listed here. And just also to mention going forward, for the short term, we are looking at staggered deliveries to match up the vaccine volumes with the availability of the syringes, and also as recommended here to go in and look at the use of 1 ml or 2 ml group syringe. In the long term, we're looking at building up a warehouse storage stock, as well as mentioned in the other slide, to encourage bundled donations. Thank you.
Thank you, Maricel and Ahita. That was the end of the session. So because of the shortage of time, we have only 7 minutes before end of webinar. We'd like to move to the next session on demand. And I will request participants to write any questions if you have on the Q&A or the chat box, and requesting Maricel and Anita to respond on that one. So we won't have a time for the Q&A, but we can do it online. So over to Lisa from WHO and Gloria from UNICEF, and requesting that we have only few minutes, so if we move fast. Thank you.
Thank you, colleagues. So on this next session, we're going to run you through the demand and RCCE implications on Pfizer, and of course, multiple vaccine introduction and rollout. Just to set us off, we're going to look at some of the key priority areas that we're considering for demand. And those, of course, include assessing the impact of Pfizer introduction on vaccine confidence through social listening and other feedback mechanisms, and then to allow us to be able to monitor and to allow us to be able to monitor the enablers and barriers of acceptance. Of course, along with Pfizer introduction is also managing the transition from single to multiple vaccine introduction in countries and understanding how this impacts the communications landscape. This, of course, will also allow us to be able to adapt the communication plans to be able to aptly respond. I don't think the slides are moving though. Could you kindly move the slide? Thank you. Another element, I'm on the point 3 now. Another element is managing the preference for Pfizer vis-a-vis other vaccine products by continuing to maintain a vaccine agnostic approach and promoting all available vaccines. Also, another key consideration for demand is ensuring that all the demand elements are appropriately incorporated into the delivery strategy, and including the mass campaign that has been highlighted in the previous session by Imran. Another key consideration for demand is, of course, re-evaluating risk communication plans and preparedness so that we can be able to aptly respond to the potential risk of IFIs. And this also includes, of course, putting even more emphasis on communicating about the inclusion of vulnerable groups. And lastly, central to this, of course, is ensuring that countries have the adequate resources that they need to operationalize demand activities. I think it's important to mention at this point that there is a program guidance that has been developed on looking at some of these Pfizer as well as the multiple vaccine introduction into countries, and we will be able to share that soon. Next slide, please. So to put these considerations for demand into perspective, we want to highlight also some of the key actions that are or could be conducted, and looking at things like managing expectations for the high demand of Pfizer. It's going to be very critical. It's going to be very critical to match demand creation to the availability of supply by ensuring that we have clear and accurate communication as part of the trust building initiatives that we conduct in communities. Also, very central to this is anticipating the specific needs of countries by taking into consideration their peculiarities, including looking at geographical disparities, looking at the gender impacts and dimensions of uptake, and also including the needs of vulnerable groups like migrants, and adapting these strategies to meet the needs. With regards to some of the insights that we have been receiving on Pfizer-related perceptions, there is some mistrust being expressed over the donations, and also issues around vaccine shopping in favor of Pfizer at the expense, of course, of other products like Sinovac. And there's also a correlation between the increase in supply with an increase in misinformation, especially online. And even though there is reported sort of like less hesitancy for Pfizer itself, we're still seeing reports of disinformation and fake news circulating. Some of the actions that are being conducted or should be conducted to be able to respond to this include, of course, preparedness and conducting webinars and training around crisis and risk communications, and then continue to engage with trusted stakeholders, including journalists, government spokespeople, and health workers, and then continuing to also share information on COVID-19 vaccine effectiveness in preventing severe health outcomes, and continue to maintain that vaccine agnostic approach. I'm now going to hand over to Lisa, who's going to run us through the wider considerations for multiple vaccine introduction and how this affects the changing communication landscape. Thank you.
Thank you, Gloria. Hi, everyone. So next slide, please. Just to briefly touch on ways in which countries can manage this complex supply and demand balance. So here's just a variety of factors that we recognize that countries are juggling at the moment in terms of their planning. There are multiple COVID vaccines available in different volumes. Those vaccines are potentially targeting different target populations. We have a complex moving picture with so many different variables, and managing this from a demand perspective and thinking about how we ensure that we're communicating with all these various populations and managing their expectations in this evolving and changing scenario is particularly complex. So as Gloria indicated, next slide, please. With program partners, we've been developing some short guidance on managing this supply-demand balance. So how to communicate and generate demand in this changing environment. And some of the key considerations that are outlined here include the communications to keep populations informed about what vaccines are available where, and to ensure that health workers are also part of those communications, not only kind of targeted, but also equipped themselves to be able to communicate this in their own communities. It also requires thinking about different ways of engaging with communities and community leaders key community representatives who are critical in also relaying accurate information into their communities, and also thinking about ways in which social media and digital communications need to be managed at the same time as well. So we will shortly be publishing this brief guidance on how to handle this particularly complex situation and the different considerations for communications and community engagement to manage expectations in this evolving situation. Next slide, please. And just to wrap up, to highlight a few resources that are available to support with the broader range of communications and demand-related activities. Here's a list that can get you all started, including a 10 steps to community readiness document, a misinformation management guide, community engagement resource, and also communications tools for health workers, particularly where situations they might be faced with where there might be people in their communities who have questions or concerns about vaccination. So we hope that's all useful to you, and thank you very much for your time today.
Thank you, Lisa. So sorry, because of shortage of time, we will, if you have any questions, please write in the Q&A and respond. So we'll move to the next is on the post poll. We have again 3 questions and we'd like you to answer. As the first one is, has the session improved your knowledge of various delivery strategies to implement in increasing COVID vaccine coverage? Yes, maybe no. After this session, I will use the guidance to develop tailored strategies for managing demand for Pfizer and other vaccines. And the third question is, has the session helped you in selecting appropriate ultra cold chain deployment strategies to implement your country? So these are the 3 questions we'll request you to answer. And then we move, in the meantime, we will move to the next slide, what's next. And so next slide, please. So the webinars materials and the is all available on the recordings are available. It will be shared. It's also available on the TechNet. If you have any questions, please, you can keep writing on the TechNet or Telegram or in the French and English, and we will be responding that one. The next slide, please. The next session will be on learnings from the Western Pacific countries, which will be on 29 September. And here's the registration link. You will be requested to link if you are interested and address that one. Next slide one. So can we have the post results, please? Yes, so on the delivery strategies, about 91% has said yes, that they got the new knowledge. Maybe on after the session, the guidance document, 83%, and has the session helped you in selecting appropriate ultra cold chain is also 83%. So in the end, I would like to thank all our participants and especially our translators for doing the translation. And that one, I'd like to thank you, all of them, and everyone to join. And sorry that we just run over by 3 minutes was a shortage of time. So I hope that you have all enjoyed the sessions, and we will be sharing these slides by link, and kindly by end, please do the survey so you can get your certificate also for the participation. Thank you, and thank you.